Glucose 6-phosphate dehydrogenase or G6PD deficiency. Presented by Sheilan F. Albite from LaSalle University Osamis College of Nursing. What is G6PD deficiency? Glucose 6-phosphate dehydrogenase deficiency is a hereditary condition in which your RBCs break down prematurely, also known as hemolysis, when the body is exposed to certain foods, drugs, infections, or stress, which leads to hemolytic anemia. It is an X-linked genetic disorder, which means it is carried on the X chromosome. If the mother is a carrier of the G6PD gene mutation, there is a possibility of passing it on to her child. A simple pathophysiology of G6PD deficiency can be explained in these illustrations. Basically, the role of G6PD is to reduce NADP plus to NADPH, which is responsible for the production of glutathione. Glutathione helps in preventing free radical injury to red blood cells. It is important to note that the conversion of glucose 6-phosphate to phosphogluconate is vital in order to have subsequent production of NADPH and adequate glutathione levels. In a normal red cell metabolism, hydrogen peroxide is made in small amounts. When there is an oxidant drug, it will interact with oxyhemoglobin, causing large amounts of production. One of the major causes of hemolytic anemia in G6PD deficiency is oxidative denaturation of hemoglobin because of certain trigger factors. When G6PD is deficient, red cells fail to produce sufficient G6PD to detoxify peroxide. Hemoglobin will oxidize, heme is liberated from globin, and globin denatures, producing Heinz bodies. Heinz bodies will induce cell rigidity, causing lysis, hence, hemolysis, leading to hemolytic anemia. You may have a higher risk of having G6PD deficiency if you are male, African American, Middle Eastern descent, or have a family history of the condition. Trigger factors include the following: bacterial and viral infections, painkillers and fever-lowering drugs, antibiotics, most often those with sulf in their names, antimalarial drugs, most often those with quine in their names, favabeans, and naphthalene, which is a chemical found in mothballs and moth crystals. Undiagnosed children and adults of G6PD may experience these symptoms when exposed to certain triggers: rapid heart rate, shortness of breath, dark yellow-orange color of urine, fever, fatigue, dizziness, paleness, jaundice, which is most common in newborns. So, how is G6PD deficiency treated? Treating G6PD deficiency symptoms is usually as simple as removing the trigger. Often, this means treating the infection or stopping the use of a drug. For a neonatal treatment, phototherapy helps in managing jaundice and preventing kernicterus. In severe cases, a blood transfusion may be necessary. Diagnosis of G6PD deficiency. A blood test is done to check G6PD enzyme levels. Other diagnostic tests that may be done include a complete blood count, serum hemoglobin test, and a reticulocyte count. Glucose 6-phosphate dehydrogenase deficiency is not curable, because it is a genetic condition caused by a mutation in the G6PD gene. This genetic mutation is present in all cells of the body and cannot be reversed or eliminated. However, it is important to note that most individuals with G6PD deficiency do not require treatment unless they experience complications, or trigger factors that lead to hemolytic episodes, which is the breakdown of red blood cells. In such cases, the focus is on managing the symptoms and preventing further episodes. Some preventions and health teachings include the following. The best way to take care of someone who has G6PD deficiency is to avoid exposure to anything that triggers symptoms. Consult your doctor for a list of medications and foods that can cause issues with G6PD deficiency. If undiagnosed, inform your healthcare providers about your suspicion before any medical procedures to ensure safe medication choices. For early detection of G6PD, have your child undergo newborn screening for early prevention and treatment of the disease. Before planning a pregnancy, pregnant women who suspect they may carry the G6PD gene mutation can consult with a genetic counselor. Genetic counseling can help provide information about the inheritance pattern, assess the risk of passing on the condition, and discuss available options. Thank you for watching.